Hey guys, Dr. Roman Burk. We had a really unusual case that I thought it'd be interesting to talk about. Typically, we see a lot of patients with ingrown toenails, and it's a very common problem for adults and children. About a month ago, I had a patient who came in with a very unusual appearance to their ingrown toenail. He thought it was an ingrown toenail. It had been red and swollen and draining for quite some time, but when I looked at it, I could tell that there was something uniquely different about this particular problem. The toenail did have a red, angry appearance to it with tissue that was kind of protruding up and around the toenail. Not an uncommon sight with an ingrown toenail. It was draining, but it had an unusual amount of just swelling in the tissues. It had a very unusual appearance to it. And so my first inclination was to take a biopsy of what we were seeing because it didn't look like normal ingrown toenails. On this particular occasion, after we got our report back from the pathologist, the biopsy told us that this patient had squamous cell cancer. That's an unusual diagnosis in the toenail, but a common skin cancer that is frequently seen on sun-exposed parts of the body. Normally, squamous cell cancer is not something that is going to be highly metastatic, meaning that it spreads to other parts of the body. But in this particular case, because of where it was located, the challenge we had is that there's not a lot of tissue to work with. Under normal circumstances, we can remove squamous cell from the skin with some simple excisions. And in this particular case, because the squamous cell cancer was right on the toenail bed itself, there's not a lot of skin tissue or redundant tissue that would allow us to simply remove the cancer. And so in this particular case, we had to remove the end of the toe. Now that sounds a little bit extreme, but when it's cancer, which would you rather do? Remove the tip of your toe or worry about whether that cancer is going to become worse? It turns out that it was a good decision because our pathology report sent back information that said that the cancer had actually gotten into the bone. Think about that for just a moment. From the top of your nail to the bone is a very, very small distance. So even a simple type of cancer can get into deeper tissues if it's left there long enough. After we got back the report, it turned out that the result of our first amputation did not completely eliminate all of the cancer. So we had to go back and we had to remove more tissue so that we completely get rid of the cancer from the body. We had to perform a second amputation of that part of the toe. And we did so with good margins, meaning that the skin edges looked clear on both occasions. Having just completed the second component, the second procedure, we will see whether we have removed all of the cancer or not. I believe we have. Our patient feels good about it, and we'll determine what to do from here by our pathology report. So we'll update you as soon as we have that.